We have all the way from Scotland. Let's give a warm welcome to Dr. Brett Duane.
I guess before I start, there are three main things I want you to bring away from this presentation to do with maternal consumption. We all know and we've heard from the speakers in the room that xylitol changes bacteria in the mouth. That's the first point. If there's only 3 points you remember from my half hour, 50 slides. Bacteria passes from the mother to child. We've seen that dental caries is infectious. And the third slide, the third most important thing is that the later the bacteria are passed from the mother to the child, the less likely the child is to have dental decay. And I want you to think about all these things because these slides keep going over this material. And if you remember those 3 points, it's important. So I come from New Zealand, got my degree in dentistry in 1993 from New Zealand. I spent 8 years in Australia, got a master's in management there. And then went to Scotland, got a Master's in Public Health there, and hopefully this year will become a specialist in dental public health. And obviously what we're talking about here is dental decay. And lots of reasons, as we've talked about, for dental decay. One of them is mutans streptococci, and we've already seen this in numerous slides today, but I guess this is the baddie, the bacteria that we try to avoid if we want to try and avoid dental decay. But there's lots of bacteria that cause dental decay. This is just one of them. And if you have mutans streptococci, you have increased risk of dental decay. And this is courtesy of Eva Soderling from Turku. It's about how is xylitol affecting mutans streptococci. So we've got this bad bacteria, mutans streptococci, and xylitol, you're probably getting the idea of this anyway. It's selecting bacteria that are less sticky, and therefore it's causing less dental decay. One of the reasons I've been asked to come is I'm involved in two things. I'm involved in my own trial that's sort of wrapping up now, looking at does xylitol reduce dental decay in children. But I'm also one of the authors of a Cochrane review of the maternal consumption of xylitol. So if you sort of keep an eye on this, because we're just reviewing the papers as we speak, what Cochrane does is gathers together all the evidence on a particular topic and actually judges the evidence as to whether it's good quality research or not so good quality research, and then puts it all together. And so what we've done is we've gathered anything that remotely looks like it could talk about the maternal consumption of xylitol. I noticed that Trish's papers turned up in there, as did John Pawdiak's. We ended up with 14 papers published, and we found there were 6 main research areas that look at the maternal consumption of xylitol in Scotland and Saudi Arabia, Finland, of course, very big, Sweden, Japan, and Indiana, mentioned as a country, but... and we got those 270-odd papers, and we narrowed them down to these papers here, and further narrowed them down, taking out all the reviews. And what I want to do is just go over the number of papers that we looked at, because it's kind of a historical lesson as to where we are with regards to the research. So first we have COLA, and I've missed out lots, but these are just people that I thought were quite relevant. In 1982, when I was 12, we had a whole lot of mothers that COLA gave basic caries prevention to. He gave diet counselling. And what he showed is just by looking at this dental counselling, giving oral health information, etc., that he showed a reduction in the mutans streptococci levels in mothers with just this preventative package. And I thought that was quite interesting, again, 30 years ago. The next thing, and this is sort of the next step up, 2 years later, the same researcher, is what he did is he had 77 mothers. He gave them a prophylactic program similar to 2 years before, and this is the important bit. At the age of 3 years, he showed that 70% of the children in the control group carried Streptococcus mutans compared with 41%. So what he was doing is he was saying by teaching the mothers, you can reduce their mutans streptococci, and you can also reduce the mutans streptococci in their children. Again, nothing to do with xylitol. But the point is, and as our colleagues have said in the room, what we've got to be careful of is we've got to realize that mothers who have not good mutans streptococci will inevitably transmit that bacteria to their children. And this is what we've got to try and reduce. fairly poor slide here, but the way we test for mutans streptococci predominantly in Europe, and what we've done in our study is we look at whether they've got high, medium or low levels of mutans streptococci, and we use Dentacult SM tests. And again, what we're trying to do is we're trying to stop people who score 2 or 3 in those tests, and to the right-hand side there, passing those bacteria onto their children. Can you see, Shirley? I've only got a piece of paper now to write my notes on. I don't know where you are, where you're hiding. Right. She didn't allow me to take my comprehensive notes. She said you should just be able to do it by heart, so I've just got this. On to sodeling now, obviously in Turku, where our colleagues in the room from. And what Ava did is she had 3 groups. This is sort of the classic maternal consumption of xylitol. She had 3 groups of mothers. One group chewed xylitol chewing gum. One group were given chlorhexidine varnish 3 times. And one group were given fluoride varnish 3 times. And she looked at these mothers, and the mothers chewed xylitol from when their child was 3 months to when their child was 21 months. The child didn't chew anything, and she wanted to know how this would affect the children. And this is quite an interesting slide, a slide I sort of drew together for the number of papers that Soderling and Isakangas published. And what it shows here is the amount of mutans streptococci you have in each group. So the blue group is xylitol, and you can see that at 1 year of age, the children had very low mutans, the same at 3 years, quite a difference in transmission, and the same at 6 years, again, a difference in transmission. And even though the mutans streptococci levels are going up, this is actually showing one of the main reasons why xylitol is so beneficial, because the longer that we can reduce this transmission, the much more they are to have better teeth. And you can see that this same result is replicated in the caries levels or the dental decay as measured by DMFT, that the children who are in the xylitol group down the bottom have much less dental decay than in the chlorhexidine varnish and the fluoride varnish group. So obviously what's happening, my main 3 messages, the xylitol is causing an effect on the bacteria. That bacteria is being passed to the children and having long-term results. So what I want to do is just go through the other few papers that are around. We've got Thorild, excuse my pronunciation for the Scandinavian people in the room. They used 3 types of gum they gave to the children. I don't know if you can see that slide, but it's basically they gave 3 types of chewing gum. Chewing gum that's really high in xylitol, chewing gum that was less high in xylitol, and chewing gum high concentration of fluoride. They gave 1.95 grams of xylitol over 3 doses. This is interesting because it's a lot lower dose than what Ava Soderling used. Again, just giving it to mothers. And what you can see down below, again, is the delayed transmission of the mutans streptococci in the xylitol group. So at 18 months, only 10.5% of the xylitol group had mutans streptococci colonization, and that's a lot lower than the other groups. Again, it's less likely for the children in the xylitol groups with the mothers that took the xylitol to have mutans streptococci. But what we're most interested in is dental decay. And when you look at 3-year-olds in the Swedish study, you can look at DEFS. It's just a term, it's how many decayed surfaces of baby teeth. And you can see in group A, the average DEFS is 0.11, low is good. And as you move through to less xylitol concentrated gums, you've got more dental decay in the 3-year-old children. It's a similar slide for 4-year-old children. Again, much less decay. Only 15% of the group of the children whose mother consumed the xylitol had dental decay, compared with much higher in the other 2 groups. And we've got Bretz in Sao Paulo, and he demonstrated that a treatment consisting of xylitol, chewing gum and fluoride varnish and chlorhexidine varnish was moderately superior, not only to reduce dental decay, but also for changing periodontal or gum disease bacteria. You had Fontana in the United States. Fontana looked at maternal use of gum. Actually, she was one of the ones that didn't notice a change in the microbiota of infants. But there's lots of variation in this research. Ava Soderling, for example, was getting people to chew gum for 21 months. You'll see my results very shortly. Again, getting mothers to chew for 21 months. Fontana was getting her mums to consume for 9 months, so there might be a reason why she had no statistically significant difference in bacteria. Then we had Nakai in 2010, and we were fortunate enough to hear her present 2 years ago in Cancun at the Xlear conference. She also looked at 107 children from 3 months of age, the mothers consuming the xylitol, and again, similar results in the Nakai presentation. Even more recently, and since we spoke last time, we've got 2 other authors, and these are the last 2 authors I'm going to talk about before I get to my results. We have Alamudi and Hanno. In Saudi Arabia, not only were they getting the mothers to chew xylitol, but they were also getting the children to chew xylitol to see whether xylitol made a difference on the mother-child pairs. And again, we had significant reduction in the mutans streptococci level in children. So I'm kind of battering you a bit with research after research after research, but these are all, we've done a comprehensive literature research, and these basically show that it's not just a one-off study, it's just not a small group. We're getting the same results for maternal consumption of xylitol study after study. So I'm going to skip to my study now in Scotland. We take the last bacteria result in March, so these are very, very early results. But we have in Scotland a program called Child Smile. It's about trying to get young children in to see dentists, trying to get dentists to stop lifting up hand pieces that we were talking about before and actually concentrate on prevention. It is highly oral health instruction focused. It's focused on diet. We also focus on fluoride and fluoride varnish. But what we did in Scotland is we recruited 250 mothers, and this is about 4 years ago when Xlear got involved. We tested them all, and we only enrolled mothers with high MS, so high mutant streptococci levels. So on those slides that I showed you before, only the mothers that scored 2 or 3. So we had to reject 70 mothers from the study. And then we got 90 mothers who took xylitol and were involved in the Child Smile program, and then 90 mothers who had no xylitol and Child Smile only. And for those of you who are interested, it is registered on clinicaltrials.gov. If you look up maternal consumption of xylitol to reduce early childhood dental decay, you will find it, and that gives you the whole protocol. And then we tested the mutant streptococci levels of the children, age 2. I should say, I was trying to find products, but everybody has ravaged the table below me. But this is basically what we gave them. We gave them, correct me if I'm wrong here, Brian. I don't know where Brian is, but I just looked vaguely and thought, hi. But thank you very much, Brian's help and Claire's help. So we gave them a choice. They could choose, the mothers could choose to chew chewing gum. Chewing gum is a little bit of a strange one in Scotland. There's a bit of a cultural issue, I think, with chewing gum. Or they could, can you see that? That's all that you guys left from the tables below. So at least the xylitol's loved. Or we gave them the ability to chew, to use the mints, and they were allowed to have, we wanted them to have 6 grams of xylitol a day. So I think from memory, 12 mints or 9 pieces of chewing gum. And then we tested the mutant streptococci levels for children aged 2. The results are not statistically significant. However, they do support the other research. So if this is, excuse me if this is self-explanatory, but what we had in the xylitol group is only 1 child whose mother consumed xylitol was colonized with mutant streptococci, compared with 7 children in the non-xylitol group who were colonized with mutant streptococci. Again, they're not huge results, because if you look at the study, unfortunately we lost half of our mothers during the study. And that's, I think it's difficult, because we're asking mothers to chew xylitol chewing gum for 21 months. It's a long time. And it may be also that they chewed the product for 21 months, but they just didn't return our calls and they just got lost. I mean, we had mothers move away, we had mothers separate. interesting enough, quite a lot of our mothers we thought would be upper socioeconomic groups, but actually a lot of them were lower socioeconomic groups. And so they had, as lots of people do in this age group, other things happening in their lives. And these are basically the percentages. Percentages actually look more remarkable. Again, very low numbers of children whose mothers were chewing the xylitol had colonization. And that brings me back to the 3 points that I made before, that xylitol is changing the bacteria, that bacteria does pass from the mother to the child, and that the later, if we can influence that transmission by giving mothers xylitol when their babies are very small, from 3 months, we can have an impact on dental decay. And again, these are my conclusions. Increasing studies that's showing that this reduced colonization leads to reduced dental caries in children. We have started doing our first checkups of our children, our dental examinations of children. We started those 2 or 3 months ago, and hopefully in a year or two's time. This is a very slow process, isn't it, Brian? As Brian and I get older and older. I think we first met 4 years ago to start the study. Hopefully we will have some dental decay results in a year or two. And that's me, if there's any questions. I'm not going to touch that, surely. I'm just going to leave it like that.